Also in 2014 is for the small plan market. This is under 50. And when an insurance company is determining premiums, what this indicates is the fact the only factors they can consider for premiums, whether the plan or coverage covers an individual or family, the rating area, age, or tobacco use. What you don't see here is claims experience. So what that means is that if your employer has very good claims experience, your rates may be going up. And if you have very bad claims experience, it may be going down. But this is for small employers. Also in 2014, as this slide indicates, every insurance company that's offering coverage in your state must accept you as an employer. Starting in 2014, there's no denials anymore. But again, if the insurance company can justify the premium, they can charge it. There's no limitations on that. But what's extremely important, as it says on slide 26, the insurer, through restricted enrollment, can restrict enrollment to open enrollment or special enrollment periods, which means you can change your coverage if you have a new dependent or if you lose other coverage. So for group coverage, starting in 2014, there won't be jumping on and off coverage for group coverage. Individual coverage, yes. Group coverage, no. Also, slide 27 is the fact that your election, you have the election to renew coverage. The insurance company cannot refuse a renewal starting in 2014. Also, there's going to be new rules in regard to wellness programs. Now remember, for wellness programs, you as an employer can sponsor two types of wellness programs: a participation-based wellness program or a standard-based wellness program. A participation-based wellness programs are those programs where you get a reward or not impose a surcharge if you just show up to a smoking cessation program or complete your health risk assessment. The employer gives you a reward. Another type of wellness program is called a standard-based wellness program, where you get a reward or not impose a surcharge if you do quit smoking, if you score at various levels in your health risk assessment. Currently, one of the requirements of that program is that that reward cannot exceed 20% of the premium. Starting in 2014, that number is bumped up to 30%. And in some situations, it can be bumped up to 50%. Now, this slide indicates, in the future, starting in 2014, in offering coverage to the small plan market under 50, insurance programs must cover essential health benefits, which means the mini-meds are gone, and basically the federal government will determine what is essential health benefit. So this is going to be extremely important. Instead of the states doing it now, it's going to be the federal government that's going to determine what coverage can be sold in a state. And many med programs will go by the wayside. Also in 2014, cost sharing. There's going to be limitations on what kind of cost sharing insurance products or employers can do. And what this slide is trying to say is the fact that for plan years beginning in 2014, a plan must not impose cost sharing in excess of the maximum out-of-pocket amounts in effect for high-deductible plans. So we're talking about a combination of deductibles, co-pays, and co-insurance. And currently for 2010, that limit for individual coverage is $59.50, and for family, it's $11,006. So what that means is that in the future, if you as an employer want to provide in 2014 a very high deductible plan, the combination of deductibles, co-pays, and co-insurance cannot exceed some number slightly above $5,950. So if you want to provide for example, a product or buy a product that is a $10,000 deductible, you couldn't do it. For individual coverage, you couldn't do it. So again, the market for very high deductible plans are going to be wiped out. Also, for plans less than 50, they're limiting exactly what the deductible is going to look like. And here, for insured products, the deductible may not exceed $2,000 in case of single individuals and $4,000 for family coverage. That's starting in 2014. So again, very high deductible products are going by the wayside in the small plan market. And also in 2014, the maximum waiting period that an employer can provide under their plans is 90 days. Now, we don't know at this point when the individual wants to be eligible for coverage. Is it the day after? Is it the beginning of the month after? We don't know at this point. But again, the maximum waiting period can only be 90 days. Now, the most important determination in the next few months is determining whether your plan is grandfathered. Now, a grandfathered plan is a plan in existence as of March 23, 2010. So any of your current plans are grandfathered. And what this slide 33 tries to indicate is the fact that, okay, it includes any current participants, any family members, and any new family members. That's what that's trying to say. Now, what this, and if you look at the second bullet, and this is extremely important, the general rule for grandfather plans is that the requirements grouped together above, what we're talking about, under the headings Group Health Reforms and Group Health Insurance Market Reforms, do not apply to a plan's coverage for an individual if that individual was enrolled in the plan as of March 23, 2010. So many of the provisions I just talked about may not apply to your plan. So this is an extremely important consideration. So first of all, it includes any participant covered as of March 23rd and any family member currently covered or will be covered. In addition to that, slide 34 indicates it also includes any new participants. They're subsequently covered after March 23rd because they recognize people come and go. But again, I want to stress to you, we don't know at this point what changes you, an employer, can make after March 23rd and keep your grandfather status. Can you change your deductibles, co-pays, co-insurance, insurers, and still keep your grandfather status? We don't know. And I'm hoping over the next few weeks and months that they will tell us exactly what changes an employer can make. Now, the next statement on slide 34 is extremely important. Now, generally, you don't get a complete buy to be a grandfather plan. As the second bullet on slide 34 indicates, there are a number of exceptions to the general rule. The provision grouped together under the headings Group Health Reforms and Group Insurance Markets do not apply. So again, many of the changes do not apply, but some do. That's what I'm trying to say here.